We're back live inside Studio 10, and you know, it seems like every time you turn on the TV, unless you're watching Studio 10, of course, you see a commercial for a new drug promising to control high blood pressure and high cholesterol. But who's really at risk for these conditions? And if you're diagnosed, what else can you do to control your blood pressure and your cholesterol?
Well, here to answer those questions for you, Jerome, and tell us a little bit more on the subject are Dr. Jose Villaplana and Tony Calvo from the Revello Medical Center. Welcome.
Morning to you.
So what causes high blood pressure? I mean, you do hear about it all the time and everyone fears it, but what is it exactly?
In 85% of the cases, we really don't know. So we go back to other risk factors like age and sex and family histories, usually.
So family histories is one that we've been hearing a lot about lately, and that there is such a genetic component to high blood pressure and even to high cholesterol. Do you see people coming in that just have no symptoms at all, but they have a family history?
All the time.
Yeah.
I see people coming for just screenings. Mm-hmm. They don't have any headaches, they don't have any buzzing on the ears, they have nothing at all. They don't have any history of having any problems. And we just take their blood pressure and they're sky high.
Well, and you don't necessarily have to look unhealthy to be unhealthy. I mean, you can be underweight and still have high blood pressure. Why is that?
That's why we call that and high cholesterol the silent killers. Mm-hmm. You don't have to have any symptoms, you don't have to have any signs at all, and you will be having trouble. Usually you don't have any presenting symptoms, as I just said, but when we check your blood pressure, when we do your blood work, we find that you have all these things that are abnormal for you, and you might be just walking bomb. We don't know what's going to happen to you, unfortunately.
And if you get to the point where you're exhibiting symptoms, then you're probably in a much worse shape at that point.
Three main areas that we focus on. Number one, brain, strokes. Mm-hmm. The heart attacks. We all know about heart attacks. Number three, the kidneys. So we look specifically at these three areas.
The kidneys?
The kidneys, yes,
really?
Sir.
So why the kidneys, though? I never would have associated that with high blood pressure.
And that's one of the worst ones, because unfortunately that goes undiagnosed for years, and by the time that they show up with a problem, they end up in dialysis.
So, Tony, you must see people coming in all the time who look completely healthy and walk out going, I'm on high blood pressure medication now, and just being kind of shocked.
Well, yeah, I mean, you see them coming in with no diagnosis, and then when they come into the room and Dr. Villaplana sits and talks to them, they're like, whoa, you got high blood pressure.
They're probably very surprised.
Yeah, very surprised. That's why we like our patients to routinely come in at least every 3 months to be followed by the physician.
Mm-hmm. And stick around, folks. In just a couple of minutes, we're going to tell you how you can get a free blood pressure screening and a free gift from the doctors here. But in regard to treating high blood pressure, it's not just a matter of taking your medication. You also have to combine that with a change in lifestyle, correct?
Definitely. It's not only that. If you think about these days how many supplements we have out there, there's a lot of things. You have your medications, First thing is a diet. You need to live in a low-fat, low-salt diet and stick to it. Mm-hmm. You need to drop the weight. If you don't drop the weight, you're going to have problems. If that fails, then you go to medications, and there's a whole gamut of medicines that you can use, depending on everything that you might have, your past history, and your other concomitant problems, medical problems.
Now, Jerome mentioned that in the beginning of this segment that we hear about so many, and I'm sure every case is different, and you have to really pay attention, as you were saying, closely to exactly what that particular patient needs. There's not just a generalized drug that helps everyone. Exactly.
I will say that, yes. And the other thing is that not all medicines are for everybody, so it all depends on your ethnicity, for example, your age, your sex. Males versus female is different. There's a difference. Mm-hmm. And any other medical problems you may be having, even lifestyle changes that you are trying to achieve.
I think it's interesting that you mentioned salt and how you should avoid that, obviously, if you have high blood pressure. But now I know a lot of the food companies, Kraft, just a few days ago announced that they're going to start putting less salt in their manufactured foods, which has got to make you guys just jump for joy.
Yeah, definitely. It will, because that's going to help us, and it's really not about the medications and the diets and all that. It's all about moderation. If you eat healthy and you do it the right way, you should be fine.
Well, we want to point out a very special offer today that Revello Medical Group is going to be offering everybody. Prime Care LLC and the Revello Medical Center want you to stay healthy, so give the Revello Medical Center a call today and schedule a checkup. The first 10 callers will receive a blood pressure screening and gift pack absolutely free. So the number to call is 813-888-8215, or for more information, you can visit them online at revellomedical.com.
And if you're new to the Bay Area, or if you're looking for a new medical provider for any reason, by all means, visit primecarellc.com. Thank you, doctors.
Thank you very much for having me.